Good afternoon, everyone. This is Kate Sweeney with LiveWell, Colorado. I'll be your moderator for today's webinar. I apologize about the delayed start. And before we get started, I just have a few housekeeping items to go over. First, we will be recording this webinar, and it will be available beginning tomorrow morning on the livewellcolorado.org website. Simply visit our website and click on the LiveWell Commitment tab. Then that will take you to our research and publications, and you will see webinars under there. Second, we will have some time for Q&A after the webinar. So if you would like to submit a question, simply type your question into the question portion of your control panel. And without further ado, I'll introduce our first presenter today, Lisa Walvoord.
Great. Thank you very much, Kate. Thank you to everybody who's joining this call. We're really excited to be sharing with you some of the lessons that have been learned and highlighting some approaches to community food systems assessments. This is something that has really taken off as a way in which to better understand our food systems in Colorado and around the country. And we've got two fabulous examples to share with you today, the first from Pueblo County and the second from Montezuma County. So I think we'll see if we can move to the, got the objectives. So the objectives today are really to learn more about how communities have used resources to do their assessments. So that's what we'll have Katie and Christina, who are together from Pueblo, and then JoDee from Montezuma will be sharing with us. We want to make sure that we highlight for you again, we've done one webinar in the past that really highlight for you again the community food assessment tools and resources that are available on the LiveWell Colorado website. And in addition to hearing how Pueblo and Montezuma have used resources for their assessments, I think you'll get a sense of some of the frameworks that you might be able to take back to your own community and really think about how you might move forward. So again, quickly, we've got a couple of presentations today. First, the Pueblo County Food System Assessment, then Montezuma County's Food System Assessment, and then we'll give you a review of the tools that we have on our toolbox, and wrap up with some closing thoughts and then open for Q&A. So as Kate mentioned, please do submit questions as they come to mind. And if you have a particular person who you would like to answer your question, if you could include that, that makes it a lot easier for us to do a good job of responding to your questions. So with that, I'm going to hand it over to our friends in Pueblo.
All right, good afternoon. This is Katie Davis with the Pueblo City County Health Department. And Christina, you want to introduce yourself?
Sure. And I'm Christina Hopewell, also with the Pueblo City County Health Department.
Okay. On the next slide, I think, yep, that starts with our team. So we had 4 people from the Pueblo City County Health Department who have been working on this. Myself, Christina, who was really the person who saw it from beginning to the end, a research assistant, and an intern through our Colorado State University that we have here in Pueblo. The Fort Collins staff from CSU was an agricultural business management specialist, a consumer choice modeling specialist, and 2 graduate students. And the reason why this team was selected was that during the request for application process, we sought after teams that had experience conducting the food system assessments. And WPM Consulting was who put in the primary application, teaming up with the CSU Fort Collins staff. And so Wendy Peters-Machete has kind of led that effort as well as an administrative assistant. On the next slide, you'll see kind of our decision-making process as to why we decided to do an assessment. And really that came from our obesity statistics here in Pueblo County. 31.2% of children ages 2 to 14 are overweight or obese, and 26.5% of adults in Pueblo County are obese. And these numbers are higher than the state average. We also wanted to look into the interlinking network of processes, resources, policy, and regulatory tools required to produce, process, distribute, access, consume, and dispose of food. We knew we had food deserts here in Pueblo County, and we also learned that we had food swamps, places where there were high densities of unhealthy food options. And we knew that that didn't tell the complete story of our aspects of or failure in our food access, but we knew there was much more to that story. So as a result, food access is not simply a health issue, but also a community development and equity issue. For this reason, access to healthy, affordable, and culturally appropriate food is a key component not only in a healthy, sustainable local food system, but also in a healthy, sustainable community. There are also many tools a local government can use to address complicated societal issues such as food access and to plan for the future of a community. So we felt that at this time it was just right for Pueblo to get this assessment underway. On the next slide, we're kind of go through how we were able to do this food system assessment. We applied for grant funding from the Office of Health Disparities at the Colorado Department of Public Health and Environment. The money is available through Amendment 35 funds. And we have spent about 1,000 hours on this project, including 10 staff members through our entire team since the beginning of February. We have a Food System Advisory Council that consists of 17 members. There's 9 in our Tier 1 component and 8 in our Tier 2. And the difference between that is our Tier 1 committee members meet once a month to receive updates and provide feedback. And the larger committee, which is Tier 1 and Tier 2 together, have met twice during the course of the project. We also have partnered with 25 organizations or different departments across Pueblo County. Just a couple to mention would be Care and Share, the Pueblo County CSU Extension Office, both of our school districts, our GIS department, the library, and different medical groups across Pueblo County.
So this project actually started with a question that we wanted to answer. So we took this as the starting point to gather baseline information, collect some unique data from our community, take a look at the economic development opportunities, our project gaps, and also potential funding resources. And we'll go to our next slide. There we go. So this food systems assessment documented the components and interrelationships of the regional food system because we realized that we wouldn't get the picture that we needed to just by looking at Pueblo County. We had to expand our perspective a little. We also looked at everything from the natural resource base, production sectors, food distribution, marketing, and choices both available to and made by household consumers. And as part of this, we looked at a larger 6-county region that included Fremont County, Pueblo County, Crowley County, Otero County, Bent County, and Prowers County. And we have a map for our area. This was our survey area that we looked at. Well, how did we go about it? We had a very community-driven methodology that we'll discuss in a little more detail. The first step that we took once we had our team in place was to develop a Pueblo County resident survey. Initially, that was distributed online through databases through many of our partner organizations. However, we recognized that some members of our community would not be able to access the online version, so we did go ahead and provide hard copies in English and in Spanish at other organizations, service provision locations, to really ensure that we were hearing from everyone. In total, we collected 737 surveys. We were able to match 684 completed surveys for our data analysis purposes. We also held public forums to discuss the project and data collection efforts with the general public and to make sure that we were on track with the changes that they wanted to see as well. Another key component were focus groups. We conducted 3 focus groups with populations that were undersampled initially in the Pueblo resident survey. We held our first one at the Board of Cooperative Education Services Migrant Education with Spanish-speaking youth. We held our second one at the Senior Resource Development Agency for seniors greater than 62 years of age. And we also engaged our rural mountain community by visiting RIE. We talked to individuals involved in organizations addressing food security issues or production within the community during our key stakeholder interview process. For those communities that may be on the line listening now, I think one of the most important steps is to determine what your greatest assets would be if you decide to undertake a project of this nature. For us, the first thing was to have an engaged, motivated FSA team. By having that, we were able to work to complete the project in 8 months. Most FSAs take anywhere from 12 to 18 months to complete. And by having individuals with background that made them expert color analysts in their own specialties, that has been incredibly useful for us during this project. Also, by having that advisory council with varied perspectives, we were able to engage everyone from private citizens to CEOs. However, the theme that brought them together was really wanting to help people in our community. We also had access to existing data sets, which allowed us to establish baseline and gaps within the first 6 weeks. And then we were able to tailor our approach and develop tools specific to the collection of unique data. Finally, one of our greatest assets has been mapping. Thanks to Shirley Schwinghammer and the entire Pueblo County GIS department, we were then able to take all of our numerical and quantitative data and turn it into visual representations. This allowed the general public to have a broader idea of what was really going on with food access within Pueblo County. And we have not reached final report stage. Our final report will be made public September 30th. However, we did want to go ahead and present some preliminary findings to this group. First of all, fruits, vegetables, and nursery crops make up about 25% of all crop sales in the region for 2007, but they're only grown on about 2% of our regional cropland, which we found to be very interesting. Food away from home represented half of all food expenditures, even though studies show that that's a more costly option. And unsurprisingly, cost was listed as a primary deterrent for purchasing healthy food in our community, even though nationwide studies have shown that fresh fruits and vegetables are actually less expensive and more health-conscious options than processed foods. So we are really going to have to counter that perception that is preventing changes in food purchasing behaviors. In addition, can we go back to this one? There we go. The thing that surprised us, though, was the distance to store being a dominant deterrent. 73% of our residents that took the survey stated they had to travel at least 3 miles in urban areas and sometimes upwards of 30 miles in our more rural areas to visit the nearest grocery store. And fast food restaurants were listed as the second most common site where residents were getting most of their food. Next slide, please. Educational attainment has a direct impact on earning potential, which serves as a great health indicator in our community. Individuals in at-risk populations, such as those that are experiencing poverty or are low income, are far more likely to suffer from chronic diseases and food insecurity. We do know that we have an educational attainment gap here in Pueblo County. As you can see from the statistics on the slide, our number of individuals with degrees, either at an undergraduate or graduate level, are both lower than state averages. Also, in many of our neighborhoods, we are facing the dual challenge of food deserts being unhealthy food swamps. Many of our low-income residents are in areas experiencing a lack of healthy food or healthy food marketing, with high numbers of convenience stores and fast food restaurants. Research has shown that having fast food outlets close to schools increases the incidence of childhood obesity, which is an issue we're already struggling with, and weight gain in pregnant women. Also, 41% of our residents that completed the survey stated that they have had difficulty feeding their families the amounts that they needed to within the previous 12-month period. So given those findings, we just wanted to leave everyone with some takeaways today. First of all, although we have many complex issues, our community is willing together to really make those measurable positive strides. Also, we need to be creative when it comes to addressing food insecurity and access challenges, because it is such a large issue for so many of our residents. And one organization cannot unilaterally decide what our community's next action step should be. It should be a very community-driven process for any municipality looking to conduct a project of this nature. And Katie and I are more than happy to field questions in the open Q&A session. Thank you very much.
Great. Thank you very much, Katie and Christina. And I've gotten little glimpses from Wendy along the way about this process, and she's been really impressed with the engagement that you guys have had from so many people across the community. So that's kind of piling on to your last comment about that no organization can unilaterally decide what the next action step is. You can't go through a food assessment without that broad, inclusive engagement and being creative about who you need to include in that. And it sounds very much like that's something you did. So we'll be eager to see your final report and to be able to share that. So again, to everybody, if you've got questions for Katie or Christina, it can be as big or as little of a question that you might have, some clarification of anything they had to say or building on something they had to say that may apply to your community. Please take a minute to put those questions in the box, and we'll also provide their contact information at the end so that you can connect with them more directly if that makes sense. So next up we have LiveWell Montezuma coordinator JoDee Powers, who's going to talk about the work that they have done as they focus on creating local food systems and improving local food production. And really at the heart of their work to access healthy food strategies has been connecting local producers with diverse markets. So a different view, but some commonalities as well. So with that, JoDee.
Hi, everybody. I'm JoDee Powers, the LiveWell Montezuma coordinator. And for those of you who don't know where Montezuma County is, we're in the Four Corners. The first slide that you see here is two of our producers, Chuck and Rosie from Stone Free Farms. And the next slide, inside a look at our food assessment. Our process, I want to say, is very similar to Pueblo's, that, we asked very similar questions. We did a lot of similar surveys, and I think that's going to be true for almost all communities that are looking at doing food assessments. We did form a food task force that consisted of between 8 and 10 members, and we did have 2 tiers, much like they did, and relied on other people to get us information that we needed. As a group, we looked a lot at other people's community food reports, and we started this process in June of 2011, and so there weren't as many food assessments out there as there are now. We had to identify what we wanted to get from a food report, and our question looked very similar to Pueblo's. And then, of course, we needed to hire experts along the way to get the information that we needed. We did work with Wendy Peters-Muschetti, and that was really useful for us because she's worked with so many other LiveWell communities. And we used similar consumer survey data so that in Hopes LiveWell at some point and Kaiser Permanente would be able to compare that data. Next slide. We did collect consumer information. We got around 600 consumer surveys, and we did a producer survey. We sent out 72 producer surveys and received close to 56 or 57 of those surveys back. These were very small, like market farmers, people who probably were farming under 5 acres, not the commodity farmers or the forage farmers that we have in our area. We did compile that data along with USDA stats and the Colorado Department of Agriculture stats, so that secondary data added to our food report, so that we had an overall snapshot of our food system. Next slide. Unlike a lot of communities, we did not have a lot of money to work with, and we really relied on our food task force and the people that, you know, our partners to help us really gather the data that we need, help us put together the information and even the reports. We did certainly rely on people like Wendy Peters and Kaiser Permanente, LiveWell experts, and another couple of economic research people. What we found the challenges was how do you narrow your focus for understanding your food system, because there are so many directions you can go in. We also understood that even though you could talk to experts in the field, that in your community and your region that probably the local people are the best experts. Another challenge that we really ended up looking at is where do you spend your money, because you can spend a lot of money and then not get a lot of useful information that's going to take you in the direction you want to know or you want to go. And then one thing that our food task force really was concerned about was who will pay attention to this information when we were done. A lot of what we've seen with some of these food assessments is that people would spend a lot of money and produce a report, and it would go on people's shelves, and people wouldn't really be looking at that information, and we really wanted to try to avoid that. So we wanted to come up with information we felt would be really useful. Next slide. After we had looked at a lot of reports, what did we want people to see and take away? And we really decided that it was important for us to make that connection between what do our local smaller producers do and how much food are they actually producing, what are their markets, and then what do our consumers want. And we actually have a fairly unique community because we identify as being an agricultural community, and we were really able to get our consumers, they really responded that they understood what was local, which was within a 3-county region. We also tried to figure out what would be useful, like a useful one-pager to talk about our food assessment. And we thought we'd seen a lot of reports that had done like a report card, like what were the good areas, what were the bad areas, where were the gaps. We didn't actually like that idea. We wanted to come up with something more positive. So what we really wanted was a strategy-based platform that covered a wide spectrum that a lot of organizations could actually take this food assessment and begin to work on different areas. The next slide. So we adapted a food system framework from a food assessment that had been done up in the Seattle area. And we came up with 4 areas or 4 goals that we wanted to focus on based on the food assessment. In terms of local food, we wanted to increase viable local options in our food system. Healthy eating, we want to make the healthy food choice an easy choice, whether that's getting people to have nutrition education, cooking classes, shopping classes. We also wanted to make local and healthy food accessible for all residents. We don't have very many food deserts, but we find that people still aren't eating enough fruits and vegetables. And then one of the other things that's really helped us in our community is promoting economic vitality, that using food and agriculture would promote a thriving, self-reliant economy. Next slide. Under each of these goals, we had objectives. And under local food, we wanted to maintain our agricultural land base and increase the capacity to produce. One of the things that we see is that small farmers can't afford large area farming or the equipment. We want to support small and mid-scale farming, and we want to work with our city to increase urban food production. And then, of course, we want to work with conservation groups to encourage environmental resource and conservation practices. In the next objective, healthy eating, we want to apply countywide solutions to create healthy food environments, working with our county, our city, and our health department. We want to increase equitable access to healthy and affordable and culturally appropriate foods because we are a diverse community. We have Native Americans and a large Hispanic population. We want to promote health by encouraging healthy food choices and provide nutrition education to students and residents. In terms of food security, we want to make sure that we increase all residents' self-sufficiency, whether that's teaching them how to garden or do small garden plots or participate in community gardens. We want to see the city and the county commit more resources to these kinds of activities. We want to strengthen our community resilience and facilitate equitable participation and discussion by all residents. Because we are such a diverse community, we want to make sure that that diversity is at the table. In terms of economic vitality, this has been a real shot in the arm for Montezuma County because I think more and more people are recognizing that by promoting local food producers and products that it's helping to boost the economy. We do have a program called Eat 5 Buy 5, and that means eat 5 servings of fruits and vegetables a day. And if each household in Montezuma County, which is around 11,000 households, purchased $5 a week of local food directly from a producer for 35 weeks, that we could actually bring $2 million additional money into our economy. We want to promote the continuation of farm-to-school and institutional purchasing of regional food products. And we want to help the local supply chain capacity, finding ways in which we can create viable distribution centers and develop the food economy infrastructure. Our last slide is, what did we learn? Lots of pathways to assessing your food system. I think that you could go into a lot of different communities and see that there are a lot of different ways in which you can assess your food system. Some people don't actually have an agricultural community, so doing a producer assessment or looking at the production side wouldn't be valuable. We also saw as a food task force how easy it was to get sidetracked by people making suggestions that weren't viable for our community. We also saw how it was easy to spend a lot of money and still not come up with something that was viable. And that in the end, like I said before, we feel that you are your own best expert, that it's great to have outside opinions, but you know your own community best. And then we did develop this framework that we're happy to share with people that I think had we had that framework in the beginning, we might have done the food assessment a little differently. But then we all agree that this 2-year-long process has been invaluable for the educational piece, all of us learning how to, learning more about our regional and our local food system. Last slide. So the food task force ended up morphing into a food coalition called Good Food Montezuma. And some of our immediate goals and how we're going to be moving forward is looking at campaigns focusing on how consumers can actually access these local foods, because we've received feedback from consumers that they don't know where to purchase or access these foods. And then we want to delve into each section of the framework. And under each section, we want to identify what is being done in that area by what local groups, and then create strategies for areas where we see the gaps, identify goals and timelines, and then engage community partners to help us achieve those goals and those timelines. I'm happy to answer any questions at the end of this seminar, and thank you all for listening.
Great. Thank you so much, JoDee. And it's good to hear some of the parallel themes between both of your approaches, some of the similarities in framework, but the really the underlying message to me is the importance, both the importance and the value in engaging your community in it. Just the process that you're going through, as you noted, is valuable in and of itself. But there is some need for some expertise from the outside, but you've got to rely primarily on those folks within your own community. We'd like to spend a couple minutes now showing you the Food Systems Toolbox on the LiveWell website, which is full of resources from many of you probably who are on the call and from other from other folks, but we've really tried to assemble some great tools and resources to make it easier for everyone and more affordable for everyone, for us to learn from each other. As JoDee mentioned, there's a desire to aggregate some of the data that's been gathered. For now, we're aggregating raw reports, and over time we hope to be able to do greater comparisons, but that really depends on more people doing assessments and actually getting sharing that data with us. So what I'd like to do is, if you can click on, under Healthy Food Access is sorry, I'm looking at the wrong thing. So community food assessments, it's not in alphabetical order, which is what I was looking for. It is at the bottom on the left-hand scroll. And to get to this section of the LiveWell website, you can, on the top there's of the homepage is Healthy Policy, and you can get there from there, or else you can just do livewellcolorado.org/food systems. And if you go first to this top level of community food assessments, that gives you a good high-level overview of why you would do a food assessment and some of the core resources. Things on getting started, some data collection, and some case studies and resources. So this is a great place to just get grounded in what a food assessment is. See, so getting started, once you kind of get that high-level grounding, is really where you can start to see some of the ideas and things to think about. So some of the things that we heard from both JoDee and from the folks in Pueblo were the importance of knowing what your assets are, of having a coalition, whether it's that two-tiered task force or whatever that approach is. You need to have a number of people that you've pulled together, and then really having a question that it is that you want to answer, a handful of questions that you start off with. And then as you can see, there goes into more of the other pieces of information you might want to get started. Then going back, and you can access this from right here on the left-hand navigation as well, but I do encourage you to go to that Community Food Assessments landing page. Then resources. There we go. I'm going to blame it on the rain that we don't quite have it together here today. But you can see there are lots and lots of resources that are out here. As I mentioned, we've been trying to gather existing food assessment reports so that you can see some examples of other things in Colorado, and we can ultimately bring some of those things together, reports together from different regional areas, and get a better picture of what's happening in Colorado. So you can see these are just a series of some of the resources that you might be able to find. So I think, as I mentioned as well, if you could, if you've got additional, I'm going to let you do that. If you have additional resources and tools that you would like to share, if you could please send them on to us, then we can promote them through this Food Systems Toolbox. And if you have places in which to share this site, some of the resources here, we encourage you to do that as well.
And we received a question about the national report that was referenced with the data for fresh fruits and vegetables. We will follow up with you tomorrow with an email, and we will include that information in there as well. And with that, I would like to conclude our webinar today. Thank you so much for joining us, and be sure to look out for that follow-up email. We'll ask you to complete a survey just to help better our webinars in the future, and we appreciate you taking the time. Thank you.
I actually had a few more things, but that's fine.
Like that.